The AC joint, which joint is that? And then how does that impact the shoulder motion for a quarterback throwing the football?
There's some terminology that I think it's helpful to explain. When you hear about a shoulder dislocation, we're generally talking about the ball in the socket dislocating. Right up above that is where your collarbone meets the shoulder. And the AC stands for acromioclavicular joint. So it's where your collarbone meets where your shoulder blade wraps around. So when you have a shoulder separation, that means an injury to the AC joint. And there's really a lot of variability in that. So there's grades 1 to 6, and it can vary from a low grade, grade 1, where you injure the ligament right up there on top, or it can be a grade 2 through 6, where you also injure the ligaments that help hold the collarbone down. And generally speaking, it's around grade 3 where it differentiates your treatment and recovery time. So if you have a low grade AC separation, that means that some of the ligaments are injured, some aren't, and you generally can have enough stability to be active sooner. If you have a high grade, that's when you see somebody coming off the field and their collarbone's sticking up in a different direction and zip code. And those are the ones that either, if you treat it non-surgically, take a lot longer to stabilize, or we start talking about a surgery, which would then put him out, for the season.